Welcome to No Filter Doctor, where we cut through the health hype, dig into what's real, what works, and what's backed by evidence. I'm your host, Dr. AK. Let's get started. Hey everybody, welcome back. We are going to talk about part 3 of our 2025 Dietary Guidelines. In part 1, we talked about what are they, what do they actually say, and how different are they from prior iterations. Part 2, we discussed the internal conflict within the guidelines. And part 3 is who makes up the committee? How are these recommendations made? What is industry influence? Are there any other recommendations that are out there? And then that will complete the entire discussion that we have on the 2025 Dietary Guidelines. These guidelines are often presented as this is very clear cut, this is evidence-based, these are all facts, but that's not exactly true. These are policy documents, so they're at the intersection of many different influences. Some of that is scientific data, but there are other factors, and some of those are industry influences. Right? So we can't always lean directly into just evidence when we are talking about public health policy. So the first thing that I want to talk about is exactly how are the guidelines created? So we've talked about the fact that these guidelines come from the USDA and HHS. They're updated every 5 years, and the target audience is really people who are working in the healthcare industry and different policymakers. But who makes up the actual committee that comes up with these guidelines? The advisory committee is typically composed of experts in various fields such as epidemiology, nutrition science, public health, medicine, and they're selected based on their expertise, experience, and publication record. And what typically happens, these experts get together, they review the available evidence, and then they do consensus building to come up with draft recommendations. And this is when different industries often look at them and add comment. And it's also available for public commentary as well. After that period, the draft recommendations are reviewed along with all of the public commentary, and then USDA and the HHS comes up with the final iteration that's released for publication. Limitations are naturally going to arise with this entire policy, right? You have a committee, there are multiple people on there, there are different ways to build consensus. I mean, consensus is not always going to be based on expertise. There are different limitations in terms of economics of the country, and so those industries are going to make comments, and those are going to be taken into consideration as well. It's not a perfect process. Inevitably, the process is going to involve interpretation, appraisal, and judgment. So it's not this very clear-cut black and white. This is the evidence, this is what we're looking at, and this is the final output. There, done. There's obviously a lot of other steps to the process. So what is that food industry influence on the guidelines? What exactly does that look like? When it comes to food industry influence on the dietary guidelines, a lot of people have this impression that like the CEO of the beef industry sits on the DGAC. That's not how it works. Like I said, these are experts in the different fields that are associated with nutrition, epidemiology, and public health. However, these individuals may have industry relationships. Let's say they participated in a research study that was funded by a certain industry, or maybe they have connections with certain food companies. There are those monetary relationships, and those have to be declared as a conflict of interest. If you look at the data, you can go back and search the 2020 DGAC committee members along with the 2025 DGAC committee members, and they have disclosed their conflict of interest. And yes, there are definitely food industries and commodities that have associations with a lot of these individuals. What we can't figure out is what is not disclosed. So disclosures, when they come to conflicts of interest, are limited in the scope of that relationship and the time frame that they exist. Perfect example is I get invited to give talks all over the place. And what I have to do for these talks is fill out my conflict of interest. And it's very well defined. What is that conflict of interest? Whether it's getting monies from different organizations. For me, it's typically a pharmaceutical company or some kind of medical supply or medical apparatus, like some kind of device sale. Then there is a period of time. For me, it's usually 12 months. So let's pretend that I work for some kind of medical device company, but I stopped working for them 2 years ago. I don't have to declare that in my conflict of interest. That's where some of the questions arise. These people who are on the DGAC, do they have conflicts of interest that maybe fall outside of whatever the defined scope is that they have to declare, or even that defined time frame? The other thing we have to consider is that these guidelines are also based on consensus. What we don't know is the human dynamics within the walls of what happens on this committee. Who is particularly charismatic? Who's really good at getting people on their side of what they want to do? That human influence is not something that can be well documented. It's not like, so-and-so who is associated with the dairy industry was particularly charismatic, and so we decided to put this in the final recommendation. You can't account for things like that. Between the undisclosed conflicts of interest and the individual influence and human interactions of these committees, it just leaves this area of gray where people often question this final dietary recommendation. I'm not an investigative reporter. I'm a physician. I don't even know where to begin to find out the insider information of what happened. I have no idea how to figure out what people's relationships are that are not disclosed in the standard conflict of interest statement. So I can't really tell you with the 2025 committee how much more influence there was as opposed to the 2020 committee. I have no idea how to tell you that. But I will say it's really naive to assume that there isn't outside influence during this process. I think it's very naive to think that there aren't other existing relationships that fell out of the time frame and scope of the required conflict. And I think it's very naive to assume that there aren't some people who are better at getting their idea or their thoughts in the final recommendation and iteration of the dietary guidelines. The fact is that personal philosophies, political views, and beliefs of individuals on that committee are going to make their way into the iteration that is presented to the overall general public. One thing that a lot of people don't know about are the uncompromised dietary guidelines for Americans. So the 2025-2030 dietary guidelines for Americans were released. In response to that, these two nonprofit companies, the Center for Science, I'm reading this directly, the Center for Science in the Public Interest and Center for Biological Diversity, came up with an alternate set of guidelines and recommendations that they call the uncompromised dietary guidelines for Americans. These guidelines were produced by organizations with no industry affiliations, and it was intended to reflect what the federal guidelines may have looked like if they strictly adhered to the scientific advice by the original DGAC. So what a lot of people think, well, not what a lot of people think, what actually happened was when the DGAC put out its initial recommendations, they got altered by the USDA and HHS. And so what these uncompromised dietary guidelines for Americans are saying, if those initial recommendations by the DGAC were not changed, this is what they would look like. And their argument is that there was a lot of industry influence in those changes. So if you take those industry influences out, this is what the guidelines should have been that went out to Americans. I've mentioned this before, that these podcasts that we're doing follow the blogs that I have already written on this topic. So I have a table in the Part 3 blog that compares the federal version of what came out, the 2025 Dietary Guidelines for Americans, versus what the uncompromised ones look like. So we're going to go through that here verbally. And if you're on the video, you'll see the chart that I put up and you can follow along. I'm going to go through this very similarly to what we did in part 1 when we compared the current guidelines to previous iterations. So if we start with protein intake, the current guidelines said 1.2 to 1.6 grams per kilo per day of protein. The uncompromised ones did not give that target in terms of protein intake. Protein sources for the dietary guidelines that were released, they did a lot of influence with red meat, poultry, eggs, whole fat dairy, seafood. The uncompromised guidelines prioritized plant-based proteins, things like legumes, nuts, seeds, and soy, and they recommended limiting red meat and processed meats. Unlike the dietary guidelines that were released, the uncompromised ones were much more consistent with prior iterations where they emphasized low-fat or fat-free dairy to reduce saturated fat intake compared to the ones that were just released in 2025. When it comes to how carbohydrates are framed, both iterations talk about fruits, vegetables, whole grains, but the uncompromised version has a stronger emphasis on carbohydrate quality, specifically fiber-rich whole foods. There's a much clearer distinction between things that are minimally processed versus the refined carbohydrate sources. They both talk about minimizing added sugars, but the uncompromised version goes above and beyond to talk about how added sugars really contribute to poor carbohydrate quality, and there's a lot of excess energy intake and more calories with that consumption. They get into the nutrition science a little bit more of those added sugars as opposed to the version that got released. We know that the most recent iteration says no processed foods. The uncompromised version doesn't do that as much. They don't take this blunt approach of do not eat processed foods. They lean more into the nutrient composition of those processed foods. So they do say that foods that are high in sugar, sodium, and saturated fat that are also processed need to be avoided. But they don't make mention of this blanket statement about ultra-processed foods. And we've talked about this before when we've talked about ultra-processed foods. It's not necessarily the processing that does something, right? The body recognizes a molecule of glucose independent of what that source of glucose is. It has to do with the other things that accompany that nutrient. What happens often is junk food, which is an ultra-processed food, then leads to this thought process that all ultra-processed foods are junk foods. And that's not the case. It really has to do with the additional nutrient composition with that ultra-processed food. So this distinction is much more clear in the uncompromised version of Dietary Guideline. This one I find really interesting. When we talk about fat and fat content, the new version talks about limiting saturated fats, right? We talked about that. Less than 10% of total calories should come from saturated fats. But it still allows that flexibility for where the fat source is coming from. The uncompromised version doesn't do that. They closely mirror the original recommendations that the DGAC put out, even of this 2025 version. So the DGAC, when they released their initial draft version, made that emphasis of replacing saturated fats with unsaturated fats, and they particularly highlighted plant sources. So that got changed with the version that got released to public, that final version that came out. The uncompromised version is what that original draft said before it was open for public comment and before the USDA and HHS made their final recommendations. When you look at the uncompromised version and you realize that that was very similar to the original draft that the DGAC presented, and then you compare that to the final version that was released, you have to acknowledge the fact that there were some external influences that changed that, especially the fact that plant proteins were really de-emphasized. Red meat had a stronger emphasis, And this dairy went from low fat or no fat to higher fat dairy. You have to acknowledge that. And you can look both of these up yourself and you can read them for yourself and then share with me what your thoughts are. But I have a hard time coming up with other reasons other than there were a lot of outside influences that directed that change. The other thing I find interesting is that other countries put out dietary recommendations. And it's really interesting when you go through and you read them because obviously those different countries are going to have different things that they deal with, including industry influence on what that final recommendation is. And so I looked at Canada because, they're so close to us, right? We're in the same hemisphere, the same continent. And I wanted to see what do the Canadian recommendations say versus what ours say. When it comes to the proteins, ours, I'm going to say this, I think ours wins. I really like the 1.2 to 1.6 gram of protein per kilogram per day. I'm a huge fan. I brought this up in the emergency department when I was working the other day. I had a patient who came in who had a terrible wound and they were having a hard time healing their wound. And I went through and I asked, what's your protein intake every day? Because your body can't create the tissues that it needs for wound healing if you are not providing it with the substrates through your diet. When it came to protein sources, the Canadian recommendations put a huge emphasis on plant-based protein sources first. And when they did talk about the animal sources, they specifically said lean red meats, in addition to poultry, eggs, different seafoods like fish and shellfish. And then they said lower fat dairy. So that's a huge distinction from ours, where ours is all about the red meat and full fat dairy. The Canadian recommendation said, now, if you're going to eat red meat, it should be lean red meat. And go ahead, if you want to do dairy, that's fine, but it needs to be a lower fat dairy. I found the processed food recommendation also very interesting. The US guidelines use very strong consumer-facing language discouraging highly processed foods, and they don't get into any nutritional composition. The Canadian guidelines, I'm going to read this. It states that nutritious foods can be fresh, frozen, canned, or dried, provided that they are low in sodium, saturated fat, and free sugars. Processing alone is not equated with poor nutrition. I love that. I'm totally sharing my bias. I love that. And one of the reasons I love that is because fresh fruits and vegetables are super expensive. Frozen ones are much less expensive. Those are also processed. There are also going to be things that are canned or dried that are processed that could be very unhealthy. A can of fruit compote is a totally different beast than a can of a fruit that doesn't have added sugars to it. So I love the fact that it talked about the nutritional composition and not the processing in and of itself. In terms of fat guidance, the Canadian recommendations are very similar to those of the uncompromised dietary guidelines. They talk about fat quality matters more than total fat. So you really want to replace your saturated fats with unsaturated fats. And if you've listened to other podcasts or you've read the blog, you know that plant sources are the best source when it comes to unsaturated fats. Very few plant protein sources contain saturated fats. Not none. Coconuts have saturated fat in them. Avocados have saturated fat. Palm oil, those kinds of things, those have saturated fats. But most of the plant-based proteins do not have saturated fats. Lastly, the Canadian guidelines took environmental considerations into play. So the US guidelines don't really integrate environmental impact into dietary recommendations at all. But the Canadian ones say that whatever we eat needs to incorporate environmental sustainability, and the food system impact has to be considered when we are making dietary guidelines. You can really see when we go through this how national guidelines can be shaped when we are saying science alone versus a lot of the other political and industrial influences that are incorporated into the final guidelines. And I'm not implying that Canada didn't consider anything else. I'm just saying that the Canadian considerations, the political, industrial, environmental, all those considerations are different than the US ones. And when you have those different considerations and different influences, the final product is pretty interesting. And teasing through those differences is very interesting. We've spent a great amount of time on this topic. So what's the bottom line? What are the takeaways? Well, I think the first thing to consider is dietary guidelines are important and we have to look at them in context. This is not your individual nutrition plan. There is nuance here. You are going to have comorbidities, certain genetic predispositions, certain economic factors that are really going to influence your access to different foods and the actual foods that you can eat. Context matters, symptoms matter, individual response to different foods matter. These all matter. And nutrition guidance should support critical thinking. It should not replace it. You still have to go in and ask the questions and consider what is right for you. At the same time, I don't think we should just blanket reject these because maybe we don't like some of what they say or we don't like the current political party who is in power whenever they are put out. Are there parts of these that are a little with their recommendations? Yes, absolutely. Does that mean all of the recommendations are trash? No, it does not. So to throw them all out the window and say, I hate whoever came up with these, I hate who they are as a person, I hate their individual philosophy, and as such, I'm ignoring all of these, I don't think that's the right approach either. There's some really good data in these guidelines, and we should consider them. There are some parts of them that are hard to swallow. I mean, during the press conference, the exact quote was, "The war on saturated fat is over." I do think that's absurd. Saturated fats are not healthy for us. There are years of clinical studies that talk about the negative effects of saturated fats. In the recommendations themselves, they say to limit saturated fats to 10% of total daily calories. So to then in a press conference say the war on saturated fat is over, that's a little bit crazy. We should not think that way at all. We should absolutely limit our saturated fats. So when it comes to these dietary guidelines, stick to the fact that less than 10% of your total daily calories should be from saturated fats. I do think we have to have honest discourse about this. When you look at them very rigidly, there is going to be some confusion. There may be a little bit of guilt thinking like, oh, this is the science that was put out there and I'm not going to do it. I'm being unhealthy, or I'm not feeding my family members appropriately, or I'm not taking care of my kids the right way because the things that I'm doing in my house aren't consistent with these dietary guidelines. That is not how these should be used. They are to promote thought. They give you a starting point, but you also have to evaluate them with a little bit of scrutiny. I love the protein recommendations in this iteration. I love the limiting of the sugar, very similar to prior iterations. I love limiting the sodium. I love that we are talking about processed foods. I think we need to delineate a little bit more about what processed foods are good versus which ones aren't. Love the Canadians and the way that they address that. I think that's something that a lot of us can use. I'm going to be very honest with all of you. These guidelines are not going to change the way I eat. I eat a nice amount of plant-based proteins and lean animal-based proteins. I do eat low-fat dairy, and so does my family. That's what we do in our household. We eat a ton of whole grains, like a ton. That teeny, teeny, tiny little bit of whole grains that is on that new food pyramid, I'm not following that. We do the My Plate, and a quarter of our meal is whole grains. We already do a lot of fresh fruits. We already do a lot of veggies. We do processed foods. We have frozen veggies. We have certain canned and jarred things. I mean, artichoke hearts, I'm not going to steam my own artichokes and then dig the hearts out and then use it in a salad. I'm going to use a jar of low sodium, without oil added, artichoke hearts that I'm going to chop up and throw in my salad. There are things that we can do outside of these guidelines. I think you just have to know, what are your health goals? And based on what your health goals are, make decisions. If you have coronary artery disease, please use olive oil. Do not use butter and beef tallow. There is a lot of evidence on the health effects of olive oil in people with coronary artery disease. I know the recommendations. I know what they are saying, but let's not just be blind to science. Let's not be blind to evidence. Let's not just use ideology. Let's be smart about this, and let's think critically about this. Make sure you talk to your healthcare team about what are your health goals and make some good decisions based off that. I hope you found this discussion helpful. I really appreciate all of you who have come along this journey with me when it comes to the dietary guidelines. And I would really, really love to hear your opinions and your comments. So definitely reach out. I would love to have continued discussion on this and more engagement on this topic. And I will talk to you next week. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter, where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor. This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship. The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, The Whole Human Health and Wellbeing. Take care, and I'll talk to you next week.